Okay. Hello, my name is Sabrina Slippo, and I'm a senior athletic training student here at Mount Union. And today I'm going to show you how I tape an ankle. So before I begin taping an ankle, I want to make sure to determine how high up and how low I want to go for an ankle tape to provide the most support. So when looking at an athlete's lower leg, you want to look for the gastroc muscle and where the Achilles tendon is attached, and you will see like a little divot of the muscle reaching out. So you want to make sure that you go up to about this high, and then when you are looking at the lower leg, you want to feel for the base of the fifth metatarsal to make sure you don't go any lower than this area right here. So when I begin, I want to make sure that this athlete has her foot all the way up in a dorsiflexion position. That way it can provide the most support as well. So I'm going to use heel lace pads, tough skin, pre-wrap, and 2-inch tape. Those are your supplies you need to tape an ankle. So before I begin, I want to make sure that I spray the area to provide support for the ankle tape, and I want to make sure that I ask the athlete, are they allergic to this? Are you allergic to it? Usually they'll say no. If they are allergic to it, then you won't use it. It just irritates the skin more. So you want to spray everywhere that you're going to put tape. And then I'm going to apply heel and lace pads around the ankle joint. This just helps prevent blistering, especially in this area where the tape can rub a lot. Then I'm going to apply pre-wrap anywhere I'm going to tape. This also just helps the tape to not stick to the skin, causing more irritation. I want to make sure when applying this that their feet are in that position I was talking about, and that I am not leaving any holes. Because if there is a hole, then that can also cause blistering. Okay. To begin, I start with 2 to 3 anchors depending on the athlete's size of the ankle. She's got a relatively small ankle, so I'm going to only do 2 anchors. This just helps attach the tape somewhere to keep it steady and not falling off. And then whenever you tape an ankle, I always go medial to lateral because you want to keep the ankle in a neutral position so that way they don't invert or evert the ankle. So I'm going to start with a stirrup, going medial to lateral, pulling the ankle in a lateral position. I will apply 2 to 3 of these, again depending on the size of the ankle. And you want to wing it out to provide more support. Then I will apply 2 to 3 horseshoes, which is again wrapping around the malleolus to keep the ankle in a neutral position. I also apply 2 more anchors just to make sure the stirrups are staying secure. My next step is to apply figure 8s, which just wraps around the ankle. As you can see, it's in a figure 8 motion. Makes a little 8. I apply 2 of these. And then I apply 2 heel locks going medial to lateral and lateral to medial as well. And these just help wrap around the heel like that. Normally I would do a continuous motion, but since I'm demonstrating how to tape an ankle, I'm only going to do non-continuous for better explanation. When I'm getting about to the end, I want to make sure there's no holes around the ankle. If there's holes, I would normally cover it up with something, so I'm just going to do another stirrup to provide more support to the malleoli. And then I'm going to cover up the ankle, make it look pretty. And then I check to make sure that it's secure. And I usually ask them if it's tight enough or not tight enough, and then I'll apply more. Usually the athlete knows what they like and what their comfort is usually they've had their ankle tapen before. We tape ankles to prevent injuries, or usually we tape them if they've had a previous injury, so that way we prevent it from happening again. Thank you.